Still ahead, the doctor's in to answer your health questions. This week, we're talking about carpal tunnel syndrome. Give us a call, 741-9272. You're watching WBRC Fox 6 News, on your side. Today's Ask the Doctor segment is all about carpal tunnel syndrome. Dr. Julian Carlo, affiliated with New Brookwood Baptist Health System, joins us now to answer your questions. Just very quickly, though, carpal tunnel is something, it's really common. You can get it from just about anything, right?
Absolutely, it's very common. It's a condition where one of the main nerves in the arm, the median nerve, is compressed at the level of the wrist, and it's going to result in numbness, tingling in your hand, usually your thumb through your ring finger. It can also cause some weakness too.
I was telling you, I had a little bit of it just from a little guitar playing the other day. But let's get to some of our callers out there. Ginger in Sneed. Ginger, what's your question?
I'd like to ask the doctor about young children, ages like 9 and up. Can they get carpal tunnel from like using computers or phones?
It's probably pretty rare for a child to have a carpal tunnel syndrome, at least from something like computer use. There's some other syndromes that may be caused by overuse on a computer that might be worth having a child looked at. But usually carpal tunnel would be pretty rare. On the other hand, there are a lot of things that can be confused with carpal tunnel syndrome. So there might be other numbness, tingling, or pain in the arm that could be caused by something else. There could be, like I said, some overuse activities. So if someone's typing or playing video games a lot, it could be causing some other issues that you might want to have looked at.
So it's different than just a cramp or something from writing too much.
Different than a cramp. It's a nerve being compressed, causing numbness and tingling. Sometimes, I guess it's debatable, nowadays whether things like computer use cause carpal tunnel syndrome. Some studies say it does, others say it doesn't. It's kind of up in the air right now.
Okay. We have another caller, Leslie in Talladega. Leslie, your question?
Yes, I have went to the doctor. I had carpal tunnel over 15 years ago. Now it's back. The doctor I went to, he said that once I had surgery through another doctor, he didn't want to do surgery. Now he said I have tendonitis. So what am I to do? My hand is very bad.
So it sounds like what you may have is recurrent carpal tunnel syndrome. So even after you have carpal tunnel released, it's possible that that ligament that was released can reform and then reapply pressure on the nerve. So it's not particularly common, but it is possible for someone 10, 15 years down the road to have some numbness or tingling develop. And I think that's worthwhile to look at because it could be the same thing over again, and there is treatment for it. That's important to know. It could be something like tendonitis, but if it was something like carpal tunnel and it's back, I'd want to treat it. Start out with a few conservative things like trying a splint, maybe trying an injection. It'd be important to get some nerve studies to confirm that it's, and a good physical exam as well, to confirm that it's carpal tunnel as opposed to something else like numbness from your neck or from somewhere else in your arm. There is surgery too. Sometimes people have recurrent carpal tunnel syndrome operated on, and it can help with the symptoms.
Can it go away on its own? A minor irritation?
It can go away. A few things you can do are take some steroids by mouth or an injection, wear a splint, give it some time, and sometimes you can avoid or at least delay the need for surgery.
Okay. Betty in West Blockton. Betty, your question.
Yes, I wanted to know what to do with my right hand. I've had carpal tunnel syndrome in it twice and had surgery twice. So I've had it in my left hand 3 times and had surgery 3 times. But now I have it back in my right hand. So what do I do?
Well, sorry you've had trouble with it. It's not uncommon for people who have multiple surgeries for carpal tunnel syndrome to still have some symptoms of numbness and tingling. I think for me the most important thing would be to get a good physical examination on you and confirm that you still have carpal tunnel syndrome.
I do. I definitely do.
And I'd get some repeat nerve studies as well. And I think if you do have something like carpal tunnel syndrome again, I'd want to make sure that the surgeries that you had done originally were done properly. And what could be offered, I guess, would be another surgery, and you'd have to go into it with understanding that it may not make you better, but I'd be happy to see you to look into it.
Okay, but bottom line, if you've got this tingling and it doesn't go away, you need to get professional help.
I think it's worthwhile to get it looked at because untreated, it can get to the point where that numbness and tingling are constant, and it can also get to the point where the motor supply, the muscles in your hand are affected, and your hand could be numb. And when it gets to that point, you can get it taken care of, but it may never get as good as it would have gotten if you had it treated earlier.
So don't ignore it. All right, Dr. Carlo, thanks for being with us. We appreciate it. Dr. Julian Carlo with Brookwood Baptist Health System. We'll be back with more in just a moment.